In this video, I'm going to show you what are the causes and symptoms of a torn meniscus. There is no doubt about it, knee injuries are painful, and a torn meniscus is no different. Not only can a torn meniscus be painful, but it can also be debilitating, preventing you from doing daily tasks that you would usually do. The bad news is that this type of injury is not rare. In fact, it's one of the most common knee injuries that doctors see. But what exactly is your meniscus? How do you know if you've torn it, and when should you see a doctor? What is a meniscus? In its simplest terms, the meniscus is a piece of cartilage in your knee. This cartilage helps to provide a cushion and stability for the joint that is subject to wear and tear from everyday life. Unfortunately, it doesn't take much to damage the meniscus. One wrong twist of the knee and the meniscus can easily be torn. This is why meniscus tears are so common in athletes that are constantly running and changing directions. With that being said, older athletes are at a heightened risk of a tear, as the meniscus tends to get weaker as we age. How do you know if you have a torn meniscus? A torn meniscus can be associated with a variety of symptoms, including a sudden popping sensation in the knee stiffness, knee swelling, knee pain, difficulty bending the knee, a feeling that your knee is locked in place. It's important to note that upon first occurrence of the injury, you might not even realize the severity. While a torn meniscus can cause initial pain, sometimes the pain is only slight. In many cases, athletes can even continue to play through the pain. It's a few hours later, once the inflammation begins to set in, that the pain may start to become more severe. So what causes a torn meniscus? As said previously, it doesn't take much to damage your meniscus. Athletes are particularly prone to this type of injury because they are constantly running and pivoting, and all it takes is a forceful rotation to your knee for your meniscus to tear. With that being said, you don't have to be an athlete to cause a tear. Heavy lifting, kneeling, squatting, and other regular daily activities can also cause meniscus concerns. As we age, our risk of a meniscus tear becomes ever greater, and degenerative changes can turn even the slightest knee twist into a tear. So, do I need to see a doctor? The good news is that not all meniscus tears require a visit to the doctor. The treatment, therefore, really depends on the severity of the tear. For less severe tears, home treatments like rest, ice, compressions, elevation of the knee, stretching, and the use of anti-inflammatory medications may be enough to dull the pain and heal your injury at home. With that being said, more severe injuries may require a simple surgery. How do you know the difference? If your injury is to the point where you cannot bend your knee, or it feels like it is locking up, that is a good reason to visit your doctor. Pain and swelling that is recurring or that will not dissipate also suggests that a doctor's care may be necessary. I hope you have enjoyed this video on what are the causes and symptoms of a torn meniscus. If you have, please subscribe to this YouTube channel and don't forget to give this video the thumbs up. And I'm sure you're going to enjoy this next video on 15 signs and symptoms of foot problems and what they reveal about your health. Thanks for watching, and bye for now.